Years old boy is referred to orthopedic clinic with symptom of right knee pain. He has suffered from pain for the last 3 months, and the pain typically lasts for several hours. On examination, he walks with an antalgic gait and has apparent right leg shortening. The right knee is normal, but right hip reveals pain on internal and external rotation. Imaging shows flattening of the femoral head, which is most likely diagnosis. So here a lots of clue. First of all, there is right pain and the pain is repeated in the past 3 months. Pain persists for several hours. There is antalgic gait and right leg shortening. Pain occurs on internal and external rotation, and also on the x-ray there is flattening of the femoral head. That means the shortage of the femoral head. What is the diagnosis? Here are the options. Options are the osteogenesis imperfecta, child abuse, osteosarcoma, osteopetrosis, and Perthes disease. So let's see. First of all, this is a femoral head, and the upper part of the femoral head is reduced or destroyed. Here we can see this is occurs, and the symptom, it is the Perthes disease. Let's see details about the Perthes disease. It is an idiopathic avascular necrosis. That means idiopathic blood supply cut off of the femoral head. For this condition, the femoral epiphysis of the femoral head, there is development of the avascular necrosis. Why the necrosis occurs? Because there is the impairment of the blood supply of the femoral head, and finally causes bone infarction and bone damage and loss of the normal shape, and followed by there is also formation of the new blood vessel and ossification occurs, and finally again develop the previous one. That means the normal shape. The bone either heal or subchondral fracture occurs. That means the healing occur, and finally it backs to its normal position. Now the clinical feature, most of them are male. That means the 4 times male than that of the female. Age group between 2 to 12 years of the age. Limb, hip pain, and bilateral in 20% cases. Here the age group is very important. In case of children, 3 important disease develop, and which is mnemonic is the DPS. D for DDAs, that means developmental dysplasia of the hip. P for Perthes disease, and S for SUFI, that means the slip upper femoral epiphysis, which is the SUFI. So DDA is Perthes and SUFI. And the age group is very important because the clinical feature almost similar in all type of the pathological condition. That means the DDAs, Perthes, and SUFI. In case of DDAs, the age group usually less than 2 years of the age, and the Perthes, it is 2 to 12 years of the age, and when it is more than 12 years, usually it is SUFI. So this age group is very important to answering the question, because the Perthes, the age group between the 2 to 12 year, DDA is less than 2 year, and SUFI, it is more than 12 year. And the diagnosis usually in the plain x-ray it is visible, but sometimes there is not visible in the plain x-ray, but clinical feature not improve. In this condition, technetium bone scan is required, or magnetic resonance imaging, which is the MRI. So MRI and the technetium bone scan usually not required. When it is required, when there is x-ray normal but there is symptom present. And the age group is very important because the clinical feature clinically almost same in all type of the pathological condition, only the radiological changes are different, and the clinical feature it's overlaps. So for this condition we have to remember the age group and also the x-ray findings. So what is our answer? It is the Perthes disease, because the age group which is the 10, and we know the age group which is 2 to 10 or 2 to 12, it is usually the Perthes disease. So their diagnosis is the Perthes disease. Why Perthes disease? Because there is the knee pain and it present past 3 months, and the pain persists for the several hours, and There is the pain on the external internal rotation, and imaging show flattening of the femoral head. Flattening, that means there loss of the cell, that means the destruction of the cell, or that means the loss of the blood supply, and it is usually present in case of the Perthes disease.